Welcome to Let's Talk. I'm your host Vaishali Patil. Today we explore a transformative journey in medical field focusing on mental health awareness and advocacy. Our guest, a former obstetrician turned psychiatrist, shares her inspiring path from delivering babies to delivering mental health care. Her journey not only highlights the importance of mental health in healthcare but also exemplifies how one can make a significant impact on embracing new calling. Join us as we discuss a vital role of awareness in breaking down stigma and fostering a supportive environment for both patients and healthcare professionals. Welcome to Let's Talk, Divina. It's a pleasure to have you here today.
Thank you very much for having me.
So, my first question to you is I know you've been a gynecologist and you've transformed to psychiatry now. So, what made you do that transformation?
Well, it didn't happen straight away. It wasn't a choice that I made. In fact, I was made aware that I'm possibly good in psychiatry or a psychological sort of outlook. I was training for public health. So when I finished my master's, one of the professors said to me, "You'll be good in psychiatry," and that's how he basically directed me towards psychiatry. And I did some observerships and I did some short-term work, and I just enjoyed it. And I felt it was more of a homecoming. And since then, I never looked back.
Wonderful. You have been in physical health as well as mental health, and because gynecology is what you've been doing, you've been dealing with women's physical health and mental health. What do you think, does the physical health affect the mental health, especially when it comes to women?
So I think you're right. I was doing obstetrics and gynecology. So it's very part focused, looking at women in their reproductive age and maybe throughout their lifespan. But it's very hard to separate physical and mental health, isn't it? So they both have impact on each other. So, for example, birthing mother, different responsibilities, hormonal changes will impact their mental health, their reproductive age. So we talk about menopause, hormonal changes. We have chronic physical health, for example, polycystic ovaries, endometriosis, chronic pain conditions will have impact on their mental health, long-term anxiety and depression, and the other way around as well. So I think you cannot separate mental and physical health. We have to look at as one entity. And my experience is that our medical sort of model is quite focused on interventions of basically looking at curing the illness, right, instead of taking a holistic approach. And I think this is being an obstetrician and practicing as a psychiatrist has helped me to understand you just need to look at a person as a whole.
Yeah. When you do your patient care, it does help you having both the sides of the story.
Absolutely, absolutely. So yeah, you need to keep both aspects for a fulfilling life.
And what do you feel when it comes to women and men, when it comes to mental health? How is their responses towards it? Is what I would like to know.
So I think women generally they are more expressive, more care seeking. They are able to share things comparatively better than men. They are more emotional. So sometimes their emotional responses can be a hurdle as well. But with men, I think society tells them to be brave. Men don't try. It takes a massive, massive courage for men to talk about their mental health. Although things are changing now, but still, I think it takes time for them to open up. And I think we are in a society where there are less support for men. Although, as I said, it's improving. Men, they don't emotionally connect with their friends. They can talk about their careers, they can talk about their lives, but when it comes to mental health or even physical health, it is hard for them to open up. Things are changing, as I said, but long way to go.
Do you remember any interactions with your patients that made you reinforce your decision of taking up psychiatry?
Well, there are many if I look back now. And I clearly remember one, I think that was quite profound. I had a patient in my gynae clinic, and she's been coming on a repeat. So sometimes it happens that you don't know what you're doing with the patient because you have finished all your avenues of treatment or potential treatment. So I was a little frustrated with myself to think about what else can I do. And I was just having this conversation with one of my colleagues, and there was a gentleman sat besides us, a doctor's sort of group, and he said to me, he said, maybe you need to give a separate long appointment to this lady and just listen to her. And I was quite sort of gobsmacked to think about someone telling me that I don't know how to do my job. But I still listened, and I gave an hour appointment, which is quite unusual for a gynae clinic because we are on a conveyor belt, very quick turnover. But I was really surprised when I did ask about how are things. She told me about what else was happening in her life, from domestic abuse to coercive behavior. And that was transpiring as pain, physical pain, which we call in medical terms psychosomatic. That was my first referral to psychiatry department. I think I realized that I just really cannot separate physical health, mental health at any stage. And I think since then my practice has changed. Even in obstetrics and gynecology, I will always put a question on, despite of whatever is happening in your health, in your body, what else is happening in your life. That gives you the cue of how we can treat people.
Yeah, that is so important. I think the way we are conditioned is not to talk about what's happening and just, keep up with the life and not discuss. Do you think that lack of awareness is what causes people not to talk, or it's a taboo? What do you think on that?
Well, you're right. We are trained in a way, isn't it? That this is what life is. Carry on with whatever is happening in your life because you're not the only one who's struggling. Everyone is struggling. So it's a struggle. So it's all right. My viewpoint is it's not about the struggle, but it's about are you stopping and just thinking about what is happening? And would you be happy to seek support? That's the first step. Would you be able to acknowledge that something is not right or something could change?
Yeah, definitely, because I think some people are also hesitant to just go and ask for help, I think.
Yeah, because either one is, as you rightly mentioned, it was stigma that you're not the only one. This is how we grew up. This is how life is, and that is okay. But then, if it is impacting your functioning, if it is impacting your sleep, if it is impacting your general well-being, then why not? Some other people might have different coping, and they're living their life well. That's fine, but it's not for you, isn't it?
I think each individual is different, and how everybody copes with things or takes things is different.
Absolutely, and I think you just have to shift one thing, and it's a domino effect, isn't it? So why are we scared to talk about, to say, what, I do not feel 100%? Why do we have to be 100% all the time? Especially with women, you have to be a best daughter, you have to be best wife, you have to be best daughter, you have to be the best. Why do we have to be the best? Why can't we be just good enough?
Exactly.
So I think that's my message to say to people, women especially, to say, what, just be yourself and seek help if you need to. Build your camaraderie, build your social circle where you feel safe, and talk about yourself.
Yeah, I think opening up is the key to everything. I think it's important to open up. And coming to this, I think most people don't even understand or aware of what mental well-being is and what mental health is. Would you like to say something on that?
Yeah, so when we talk about psychiatry in general as a medicine, field of medicine, we deal with psychiatric disorders or mental illnesses. So, if we look at the umbrella terms, we can talk about depression, mood disorders, bipolar disorder, anxiety disorder, psychotic disorders. So these are disorders, but they are illnesses, right? For possibly for that you need medications, you possibly need therapies or generally sort of biopsychosocial uh, um, support. But mental well-being is something we call it as, in a way, preventative. It's a lifestyle, right? So sometimes people confuse these two things. So someone might have mental illness but also have good mental well-being, in the sense they have a job, they have financial security, they have friends and family, they are looking after their lifestyle, eating well, exercising well. On the other hand, someone might not have any mental illness, people like you and me, who are generally sort of working, earning, have family, but not looking after their mental well-being because they might be isolated. They're not eating healthy, 3 or 4 times takeaways, putting on weight, drinking alcohol, not sleeping well. So that is impacting their general sort of well-being. So they're two different things, really. And again, we need to think about that. We need to incorporate mental well-being in our life.
Yeah, I guess a lot of people don't know this differentiation, and it is so important to differentiate these two things and take steps accordingly. What individual needs. So that is very important.
Yeah.
Been part of NHS and working with NHS, you must be coming across a lot of diverse cultures and people from different backgrounds, different ethnic backgrounds as well. So, have you found any difference in how people from different backgrounds approach or their sense of awareness? What have you felt in that area?
So yes, there is a difference, definitely. Ethnic minority, if you think about the uptake generally is not great. Uh, think about, in England we have a massive community of Asian population, but when you look at the service uptake, it's very minuscule. Again, it is about the awareness. It's also about the stigma. I think more of the stigma, because mental health is not spoken and open, uh, although they are aware of the services. I think it's okay if, suppose for example, you fracture your leg, it's all right to go to A&E and get the treatment, and when you reach home there'll be people with get well soon kind of cards and speedy recovery wishes. But when you have fractured thoughts, nobody knows about it, right? Only you know about it. And your family possibly knows about it, because the impact is ripple.
Yeah.
If you're not functioning well, it will have immediate impact on your family. But it's so really difficult to talk about that and seek help, right? One, there is a potential that people will feel that you're weak, that you cannot handle. Second, what society will say. The closer community, the Asian community, they are very close knit. They live in their own sort of little bubble. They have massive community support. Sometimes, possibly, they think that it can be managed within their own community. Third, although they are aware of mental health services, but sometimes I do wonder people don't know the pathways where they can seek help and support. Not for every small little thing that you have to go to A&E. And I think maybe we can do a little bit better with that kind of awareness to say what are the services available in your local area. And sometimes you can seek those services in confidence as well.
Okay.
But as you question, yes, there is a massive difference between the service uptake between ethnic minority and the local population.
Do you think, people from different backgrounds react differently to situation when they have a mental health issue?
Yes, and I think culturally things are different. Your sort of understanding of mental health is different. Your sense of entitlement is different. Unless they have reached to a breaking point, they will not approach the services, despite having information of where to seek help and support. So throughout my sort of career, although we have a good chunk of Asian population here, I have seen handful of Asian patients myself. So there is a massive disparity there.
Do you have any case like that, similar situation, but people have dealt with in a different way?
Well, there's some positives in Asian population as well, because they're very family focused and generally the family support is massive. But the difference I remember it is I had a young gentleman from Asian community. He was admitted in the ward. They wanted him to be discharged very quickly. Didn't want to stay for longer period that we were sort of advocating. And the reason was he'll be supported at home. And rightly so, the most recovery happens well at home. Hospitals, psychiatric hospitals are not the best of the places to be sort of cared for. But I think the rush to bring them back home was massive. And sometimes my experience is they do not want to follow up with the psychiatric services as well. Again, it could be because of the stigma. Things are improving over the years. But as I said, the positive is that because they have massive family support, recovery happens quicker.
In this situation, if it was a local person, do you think they would be more open to take the treatment and to talk about mental health and well-being, or how have you seen that interaction?
I think generally they're open, but I think it's also it's very hard to sort of tease that out because it is also individual preferences as well and their own barriers to seek support and help, regardless of whether they know about mental health. Awareness is there, but again I think it takes courage for people to go and seek support. So if you think if I put it very simply, yes, there is a difference. The uptake of services are much better in English population, but then it also have impact on individual basis whether they seek support or not.
I would say, rather than just cultural or ethnic backgrounds, it finally comes down to an individual, how he wants his life to be.
Well, yes and no.
Okay.
Yes, because it's an individual responsibility, but no, because there needs to be a pathway. Because if it is easy to seek support, the chances are that they will approach or they will take the offer. Sometimes, as I said, people don't know. They know that they need help, but they don't know where to find that help. Not every person has to go to A&E, isn't it?
That's what I think. People should know more about the resources and where they should reach. I think that's the key point here to be understood, that awareness and resources have to be available and it should be out to the public is what I think.
It's improved massively. Now, even in media, high profile people are talking about mental health.
Yes.
So I think it is picking up. but still at individual level and local areas, if you think about, there's massive disparity.
My next question here is how does your public health services help you in, catering individual patient care?
So many years ago, when I did my master's in public health, I was quite surprised that there was no public mental health aspect to it. But if you think about public health skill set, they talk about preventative aspect of any illnesses, and that's exactly what we are looking for mental illnesses now. Mental well-being, how can we prevent someone developing mental illnesses? They are very data driven, very focused, similar to now we look at all the evidence-based practice, gather the data and look at what are the services that, especially for mental health, what are the service need of this particular population. Now, I did talk about the preventative aspect. Also, the public health sector works on early intervention, screening and early intervention. Similar to mental health, now we are doing early screening and early intervention. For example, if someone has psychotic illness and if we can give them early treatment interventions, maybe treatment as in medications or therapy, the outcome of that illness is much better. In my individual in my practice, as an individual practitioner, my team members, so we have started with looking at, despite of treatment and intervention that we have to do in secondary care, but we have started talking about, as I said, preventative aspects and early interventions to say if you were to have any such relapses, what you need to do. So looking at primary, secondary and tertiary care, we can easily navigate through the treatment plan. Again, data driven, you collect the data and look at what are the service need in this particular population. So I think, yes, public health skills are very helpful in developing the services in psychiatry and
Right.
yeah, and then giving the best in that population, because every population will have different needs specific to that area.
You mentioned about preventive steps that can be taken. In the preventive stage, what would you advise? How does someone know they need to seek help? Something that you could elaborate on. What are those things that people should look into?
So when we talk about preventative steps, we are talking about the steps before the illnesses, so that either we can avoid the illness or we can prolong the symptoms emerging. If we look at mental illnesses, some psychotic illnesses, some mood disorders, they're in family, they have genetic propensity, but it also has your life experiences and societal challenges that can surface the illnesses. If someone is using drugs and alcohol, so the chances are the illness might emerge a little earlier, right? So it's about the preventative aspect would be avoid drugs and alcohol, and again looking at your lifestyle, right? Now looking at the depression as one of the examples, if someone has a family history of depression, then the chances are that at some point, again, they might suffer from depression, but what they can do to avoid that. So again, looking at, are they looking after their well-being? Do they have family support? Do they have social circle? Do they have safe support, safe space where they can talk about their difficulties, emotional difficulties? They're not living an isolated life. So these are the preventative aspects alongside your physical health and exercise and general nutritious food and stuff. So now if you know that in your family someone has mental illness, history of mental illness, then they can possibly have to be a little bit more proactive in looking after their well-being, right? But in case they have reached to a point where they feel that something is not right and something is out of character, then they need to seek help, at least to start with going to the GP, or to seek support from the family and friends, to at least share their difficulties and navigate through the systems then.
Creating more awareness, especially I think preventive measures, I don't think many people know. So I think awareness, talking about the resources is so important.
Absolutely, absolutely. I think generally, if you think about, people are getting more aware now, but then do people know which pathway to follow if they need help? Not everyone needs to go to A&E for their difficulties.
Yeah, and I think it's very important even to know when,
Yes.
That's so important.
Yeah, absolutely.
So coming to our next question, Divina, we all know that every profession has its own stress levels, and professionally we have to deal with some stress at some point. And I think healthcare professionals have even more burnout. So with kind of schedule that you have, how do you manage your mental well-being, and how you keep on top of things, if you would let us know?
Can I be very honest? I don't understand stress, because it's like a car, isn't it? You cannot drive with no fuel. So you need to have stops to refuel. Similar with life. And I think I have been pretty good. I think maybe when I was growing up, that kind of environment, that stress is always manageable. And if something is manageable, it's not stress, right?
That's a great phrase.
So that's what it is, really, isn't it? Stress is when you have reached to a point that you're not able to manage something. It could be anything. So I think for me, it's about future planning. So for example, yes, as I said, it can take a toll on your psychiatric practice. Generally, if you think about, it can take toll on your emotional well-being, because you're dealing with people who are really, really struggling. And sometimes it's nice because you see a very unwell patient, you've done some intervention and they become well, and you see the impact that they have on their family, not for them, but impact on the family. So that's massively rewarding. But sometimes you are there treating someone, not getting the response or the results that you want, and it can be frustrating. And that is not just about the individual level of me and my patient. It's also about the service demand. It's about the funding cuts. In an ideal world, we want everyone to be admitted or given full interventions, whatever is required. We do not have that. So yes, those kind of stresses are there. But then the idea is you have to manage with what you have, right? And then you have to set expectations, your own expectations, and your patient's expectations, and your staff expectations. And when that matters, yeah, you can manage it. But if you think about the burnout kind of stuff, as I was talking about, that is about the mental well-being, that comes to the forefront. For me, I am pretty good with it. I look after myself. I have a great family. I have a great set of friends. My workplace is fantastic. It is my second family wherever I go and work. I love to host. I am a foodie. I love to invite. I love to cook. I love to invite people. That gives me energy. Then I do some gym sessions. I run. I bake. I read. So I have loads of resources to literally pull out to look after myself.
Yeah.
And I think personally, this is what I have understood, that if you take time to look after yourself, and if I'm good, I can look after you. So it's like when you fly on the plane, isn't it? And they say it's a pressured chamber, and if the pressure goes down, you will have the oxygen mask. They always say to put this oxygen mask to yourself first. But if you think about, as a mom, I have an infant and I have an elderly mother with me. The first instinct is to put and help them, isn't it?
Yeah.
But if I'm not 100%, I cannot support anyone.
Agreed.
So I think that's where I think I'm pretty good with it.
Yeah, so yeah, basically I like what you said, doing little bit of everything, allocating your time for different things that you like. I think that helps deviate from just the routine. That's what I take from what you're saying, that it just helps taking care of your mental well-being.
Yeah, absolutely.
When we were having a conversation, I remember that you're quite keen on the financial literacy, helping people, or giving your input, whoever needs. So that's very intriguing for me. What would you like to say?
So, as I said about mental illness or mental well being, this is not, uh, at least when I was growing up, we were not taught about those mental well being kind of stuff. It was part of our curriculum, but it was never spoken in out, right? Same with financial literacy as well. This was a hush hush kind of conversation, taboo to talk about money. People who talk about money, they're bad, or people who have money is bad, they're bad. But I think when I was growing up, I realized that money is just a tool. What you do with money is different thing, right? You can use that money to flash on for anything, or you can use it for philanthropy. Basically, money is just money. Yeah, you add value to it either ways. But when I spoke to people around me, and I'm talking about professional women, and I was very surprised to see that they had no clue where their money was going. What do they do with the money? No idea. Apart from a little bit of shopping there and here, that's fine, but everything was managed by their family members, mostly husbands. So I think that's where it all started with, that everyone needs to be responsible for their life. My viewpoint is that you don't need to manage everything, but you need to be aware of it, right? That's one point. And it's when I speak to people and they say, well, we're not interested in money, then it's not a matter of pride that I'm not interested in money, because eventually you'll have to pay the bills that will require money. You will have to live a life that will require money. You might not need massive amount, but you need a amount, right? And that's where it all comes in. To this all financial literacy stuff is that, can you reach to a point in your life where you do not have to work for money? You have enough coming in to sustain your life. It could be any lifestyle. Then you have a choice to work. And when you have a choice to work, you work at your own terms. And when you work at your own terms and you don't have to work, the quality of work that you produce is massive.
I think to some extent, even finance do affect our mental well-being and mental health. We are never taught, how to manage money or about the finance. I'll be honest, I have been a dentist as well in the past. When in India, I knew about my dentistry, but as a business, how to manage my dental business, or how to manage the money or invest, I was clueless. So I totally agree what you're saying, and that's a very important part of your life. So yes.
So imagine you've worked hard, you become a dentist or you become a doctor, you become any professional, and then you are told that to complete this job you have to learn how to drive. So because you have to commute, you learn to drive, right?
Yes.
So finances is not something that is rocket science, isn't it?
Yes.
So why people shy away from that?
So I remember in the conversation you mentioned about baking. I was wondering, how does baking help you? Do you think it's therapeutic in some sense, or in what way? Because for me, in the past, of course, I don't cook much now, but cooking used to be therapeutic for me, and I used to enjoy. So does it help you in that way? In your mental well-being?
Yeah, I think baking, not just baking, but any other hobby, if you think about it does help you, isn't it? It's for yourself. You're doing it for your soul, right?
Yeah.
But baking per se is fantastic for that. One, it brings people together. Be it family, be it friends, be it workplace. Any difficulties, you bring the cake and coffee, conversation start. So that is what I really like about that first. Second is when you bake, you have to be very meticulous. You have to measure, you have to try new recipes, you are constantly sort of thinking about creative ideas. So it translates into the creativity in your workplace or your family situations as well, because that in some ways your brain becomes more creative. Then you have to be very precise, you have to have time management. You also sometimes you whatever you're trying to bake, it might not go to the plan, so you have to sort of troubleshoot, or you have to improvise, and that can be translated into, so these are the kind of softer skills that you are developing while you're baking, and the outcome of a cake as a cake is fantastic. But what I like about my baking is, because yes, it is therapeutic, it is my time, I enjoy it, I don't feel tired after completing sets of bakes. But I also raise funds. It is so really easy to raise funds with baked cookies, so for charities. So I think, yes, if you think about it, it's me time, my time, and it just brings people together. Raise funds. What else can you ask?
I think it just helps to build more skills and being patient and being creative and being focused on something,
Yeah.
which again is a helpful tool, I think, in terms of mental well-being.
Yeah, absolutely, absolutely.
So Divina, my next question is, how can we integrate mental health in our general practice? What is your advice on that?
I think they are integrating now, in some sense. As I said, we have come far from previous era, if you think about. There has been collaborative work with mental health services and primary care services. Most GP surgeries now, they have psychiatric nursing input, so they can triage that, and then if required, they can be sent to secondary services. So in that sense, it's really good. They're screening well, but I think we still need a little more collaborative work. We still have mental health as the poor cousin of the acute medicine, so we still need to bring that parity, that your physical health and mental health is at par, equal. So I think the healthcare workers needs to have these conversations with their patients at every opportunity. It's like every consult gives you an option to talk about their mental health, their well-being, or maybe, as we talked about, their preventive, what else are they doing in their life to prevent that, right? So I think that a little bit more training with healthcare staff, more conversations there, workplace conversations. Most GP surgeries now have psychiatric sort of input. In general hospital, we need more opportunities to talk about mental health and mental well-being in every consult. So I think that is still lacking. We are getting there, but still it's work to be done. That is one. Second, I think interdisciplinary approach is very important. The barriers to reach out to the professionals from different sectors, so any orthopedician or respiratory physician, they should have direct contact with the psychiatrist or psychiatric services, so that we can catch things quicker than waiting and or working in silos and ghettos, right? This is not my problem kind of stuff. It's our problem. It's our patient. It's not my patient or your patient. So I think that awareness is important. And then primary care sector definitely is improving. We need a little bit more funding, more awareness, more signage for social prescribing, which again is happening, but it still needs a lot of work to be done.
we do the patient's history form, do we have any other questions apart from the medical questions to know more about the patient?
So, if we think about the primary care, when they have patient demographic sort of information, they will have their employment status or their marital status or their sort of family structure, some information on that. But generally, I don't think they have questions about what they're struggling, because especially in GP, general practice sector, they go with a problem and GP deals with that problem. In those 10 minutes, you have limited time to deal with anything else. It comes as the person's responsibility that if they're struggling, they have to sort of speak to the GP. Yeah.
What would you like to advise our listeners so they take little measures in day-to-day life so they can, do good with themselves and have a good mental well-being?
Keep it simple, right? Look after your health. Look after your food. Look after your sleep. These are the basic foundations. So if you're good with sleep, if you're looking after your physical health, 15 minutes, half an hour, walk, anything that you can do with your physical health. 3 foundations, basic. And then if you think that something is not right, speak, seek help, talk to people. 4th thing is develop something which is unrelated to your day-to-day work. For example, develop a hobby, develop a skill, because if you are learning every day, you feel you have accomplished something. It's a journey, isn't it? So it's about how you grow 1% better than yesterday. And before you know, it's the compound effect of what you have done throughout your life, and that will take you where you can have a fulfilling life. Keep it very simple, nothing extraordinary.
Developing something or learning something different every day and having those small accomplishments, I think, just gives a sense of satisfaction just to push yourself and you just build your self-confidence and just keep moving, I guess. Wonderful. Thank you so much. It was lovely to have you today, and let's keep talking.
Thank you very much. It was a pleasure.
As we conclude today's episode of Let's Talk, I want to extend my gratitude to our remarkable guest for shedding light on her inspiring transition into psychiatry. To our listeners, remember that raising awareness and understanding is the key to breaking the stigma around mental health. If you found value in today's conversation, please share it with someone who might need to hear this. Our guest has been generous to put together a document on some resources that might be helpful to you. To receive your copy, please get in touch with the email provided in the description. Join us again for another episode on Let's Talk, where we continue to promote understanding and empathy in the realm of mental health. Until then, keep advocating for awareness and supporting one another. I am Vaishali Patil, your host at Let's Talk.